Hi, I'm Nick, a physical therapist from Meadville Medical Center. Today we are going to go over our pre and post-op knee exercises after your total knee replacement. With us today we have Sandy, and she is going to be demonstrating those exercises for you. These exercises are going to be done twice a day for 10 repetitions each. When completing these exercises, they may be uncomfortable, and that is okay. If the exercises become painful, please stop. The next exercise are ankle pumps. This exercise can be completed lying down or sitting. We are going to demonstrate to you in lying position. So Sandy, what you're going to do next is you're going to take your toes on your operative side and flex them forward to the sky as far as you can. Good. And now you're going to point downwards to the ground, nice and slowly, and then back up. That is 1 repetition. All right, let's go ahead and show them again. So go ahead and pump it up and then push it down, nice and slowly. These exercises are going to be completed twice a day, 10 repetitions each. The next exercise is the quad set. So Sandy, to achieve this exercise, what we're going to do is you're going to tighten your thigh muscle and try to flatten the back of your knee down into the bed. So go ahead and squeeze and push that knee down, tightening all the muscles in your leg. Hold for 5 seconds and then relax. Good. Go ahead and try again. Squeeze and hold for 5 seconds and then relax. To get a better stretch behind the knee, what we can do is we can take a towel roll and place it underneath your calf ankle region. And then, so now that there's a space behind our knee, we can now tighten this muscle again and push that knee down to really try to get a stretch and pull back in here. Hold for 5 seconds and then relax. Good. Let's go ahead and show one more. Good. Hold for 5 seconds and relax. The next exercise is the straight leg raise. What we're going to have you do next, Sandy, is bend your non-operative leg up onto the bed. Good. And then you're going to tighten your operative leg and lift it up to the height of your opposite knee. Good. Once you get to the top, you're going to hold for 1 second and then come on back down. That is 1 repetition. You're going to do this 10 times, twice a day. So go ahead and show another one, lifting it up, keeping that leg nice and straight, and back down. Very good. The next exercise are the heel slides. This exercise is going to be completed while laying down. Here I have a slide board that we use here. What you can use at home is a cookie sheet, a cutting board, a pie tin, anything slick to make your foot slide easily on the bed. So Sandy, what we're going to do here is I'm going to place this slide board underneath your foot, okay, and leg. Good. And then what you're going to do while maintaining your contact of your heel with the board is you're going to slide your foot back while bending your knee. Great. So you're going to come as far as you can. Great. And then hold it right there for about 10 seconds. Good. And then relax it back down. Great. All right. We'll demonstrate one more here. Go ahead and slide that foot back, maintaining that contact with the heel on the board. That's great. As far as you can go. Again, so this exercise is going to be uncomfortable, but it should not be painful. If it becomes painful, let's go ahead and stop or not go quite that far. Go ahead and relax. But you have to remember that you have just had a knee replaced, so this isn't going to be feel great bending it, right? So go ahead and slide that foot back as far as you can again. Great, on your own. Hold for about 10 seconds. That's great, Sandy. Each time, if you can try to go a little bit further, that's the ideal goal without causing pain. Go ahead and relax it back down. The next exercise is the short arc quad. So what we're going to do next, Sandy, is we're going to take a towel roll and roll it up and place it underneath your operative knee so that there is a slight bend in your knee. Good. So to complete the exercise, you're going to tighten this muscle, your quad muscle, and straighten up your leg off of the bed like so. So go ahead and squeeze this muscle and straighten your leg up. Good. And then hold for 1 second and then relax. That is 1 repetition. Let's try it again. So tighten up this muscle and lift your leg up off. Good, while maintaining the back of your knee on the towel, and then relax, holding for 1 second. Let's go ahead and show one on your own. Great, hold for 1 second, and then relax. The next exercise we're going to complete is the knee range of motion. To complete this, you are going to be seated in a chair with a paper towel or something slick, maybe a wax paper or a garbage bag or plastic bag underneath your foot so that your foot is able to slide underneath of you. So what we're going to have you do then is scoot to the edge of the chair and then slide your foot back underneath of you as far as you can. Once you have achieved as far as you can get it, you are going to then hold it there for about 10 seconds. This may be uncomfortable, but should not be painful. After you've held for about 10 seconds, go ahead and then straighten your leg out as far as you can. And then hold it there as well for 10 seconds. That is 1 repetition. We are now going to demonstrate a stair transfer. So whether you have 2 steps, 5 steps, or a whole flight of steps to get into your house, we want to make sure that you're able to get into the house safely. So what we have here is a stair setup with 2 handrails. Now you're not always going to have 2 handrails at home. So today for demonstration with Sandy, we are going to show using a left handrail and your cane on your right hand. Okay? So Sandy, go ahead and approach the stairs so that you are squared up with the steps. She's going to take her walker with her so she maintains her safety. We want to limit all risks of falling. Get up there nice and close. Great. Once you've achieved this position, we're going to go ahead and get rid of your walker. You can hold on to the left handrail and then take the cane in your right hand. Again, it does not matter what handrail you use whatever you have available to you. So then, Sandy, what we're going to have you do next is go ahead and step up nice and close to the stairs. Yep, get right up to the edge. And then you're going to take your non-operative leg, so in this case for Sandy, it's going to be her left leg, up onto the steps first. Before she does that, I do want her to make sure that she takes her operative leg and tightens these muscles and keeps that knee nice and straight so that that knee will not buckle on her. Okay, so Sandy, go ahead and tighten this muscle and then step up with your left leg. Great, and then go ahead and complete the full transfer. Great. It does not matter, again, where the cane is. It can be down on the step below or above, whatever you're more comfortable with. Main thing is making sure we keep this knee nice and straight. So go ahead and straighten this muscle, or this leg. Step on up. Great. Great. We'll go all the way to the top, Sandy. 1 step at a time, always leading with your non-operative leg. Great. Great job. Good. So once we get to the top, let's slowly turn, nice and slow. Yeah, keeping that leg straight when you're putting all your weight on it. That's great. So coming down, we're going to get up right close to the edge of the stairs. Again, holding on with the left handrail, and then you're going to take the cane and place the cane down on the step below you, and then step down with your surgical leg first. Great. Now when you put all your weight on this leg, go ahead and straighten that knee out. Great, so it doesn't want to buckle on you, all right? Using your arms out in front of you. Great, Sandy. Cane down first. Step with your surgical leg. Great. Surgical leg first. Control, nice and slow. Great. And then we'll have the walker in front of you once you get to the bottom. Surgical leg. That's great.
Hi, my name is Kayla. I'm an occupational therapist here at Meadville Medical Center, and today I'm going to show you how to transfer in and out of the tub following your hip or knee surgery. So what we're going to have Sandy do is come up to the tub and step in with the non-operative leg first. So her left leg will be facing the tub. We're going to have her angle her walker at a 45-degree angle so that she doesn't have to step around this walker leg. So first she'll step in with her non-operative leg, leaving enough room for the other leg to come in, and then in with the operated leg. And always remembering to bring that leg behind you. So to step out, she will step out with her operated leg first, leaving enough room for the other leg to come out, and then out with the non-operative leg. And if you have a grab bar, you can use that to hold on to in your shower, or you can use the wall for balance if you need to.
Thank you for watching the video, and thank you, Sandy, for being our patient today. If you have any questions, please contact your physician at Orthopedics Associates of Meadville or your physical therapist at Meadville Medical Center.